Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome back to You and Your Doctor, where we're teaching you how to live longer and healthier. Because with All County Healthcare, who are our proud sponsors, patients is the heart of their business. And I want to emphasize something. You know, not only is patients part of their business, but their patients is what you would be receiving. They are one of the companies that have care, compassion, patience, and they listen. They listen to their patients as well. So you are streaming live here on Facebook. So I want to welcome all of our Facebook listeners. And if you have questions about All County Healthcare, please give them a call at 888-717-7170. Ask for Maddie. She would love to answer any questions that you might have concerning healthcare, aftercare, after you come out of the hospital. They've got everything for you to be able to assist you in being at home, being in your own space, and bring you back to health as well. So it's great to have you. I'm Lorena Anderson, your life and energy coach. And we have another professional doctor here with us. And, he's from the Orthopedic Center. And I'd like to welcome you here on the show. We're here, by the way, we're here every Tuesday, 6 to 7. And if there's any doctors out there that would like to be on our show as well, please give us a call at 888-565-1470. We would love to hear from you. So welcome. Please introduce yourself to our audience.
Thank you for having me. My name is Juan Agudelo, orthopedic surgeon with the Orthopedic Center of Palm Beach County. We are 15 physicians, and we take care of all the orthopedic injuries from neck to toes. Neck to toes.
So from here all the way down. Excellent. Well, welcome. It's wonderful to have you. Thank you for taking time out of your busy schedule. I know how busy you are to come and be with us to help educate us and teach us about your profession and also what we need to look for. You were talking about orthopedics. What particular area are you specifically looking at?
My specialty is hip and knee surgery. I did, after finishing orthopedic surgery training, an extra training in joint replacement and reconstruction, including minimal invasive techniques, robotic surgery for the hips and knees. So it's a very exciting field. It's growing, changing, and robotics and minimal invasive surgery are just booming. And so I'm very excited. And yeah, it's a great opportunity to be here sharing the information that we have.
Oh, that's wonderful. So it is great to have you here. What made you get into this field?
Well, I love orthopedics since I was in medical school because simple surgery will get the patients back in track. Mm-hmm. In no time, they will be active again, enjoying their life. So if they have a broken bone, you just fix it, they get up and walk. If they have arthritis, you an injection or physical therapy or a brace or a surgery, but the patients see the improvement and they can go on and get with their lives, which is very exciting. So they come back 1 week, 2 weeks after surgery, happy, the pain went away, they can be independent, they can move, they can return to their physical activities. So it's really, really rewarding. And also, we get to play with all the toys in surgery, all the technology. So it's another perk.
Well, something that's really cool because that says that you've got quite a progressive office that you're associated with. And the fact that they have decided to bring in all this state-of-the-art technology, what better area could you be practicing in that would allow a patient to have, say, need knee replacement or knee surgery of some sort, and to be able to have that technology and to be able to use that technology as well. Kudos to you.
Thank you. Absolutely. It's extremely exciting. We stay with the state of the art, but we only use treatments that are approved in serious research. So when we offer a new treatment, it's because we are convinced that we're helping the patient. We don't necessarily offer the newest thing just because it's getting a lot of attention. We are very careful. We select the proper treatments for the proper patients. So really, you need to sit down, understand, and get to know your patients, because everyone's goals and knowledge and culture is different. So you really need to connect with your patient first, and then offer new technology if it's the good thing to do for that particular patient.
Wow. Well, that's really good. And what I'm hearing is that you really take your time in being able to understand your patient's needs, and then be able to, identify what's best for them. So
correct. That's a key, or the key part of being a physician. Really, you need to connect with your patient first. It's not about how good you are at doing surgery, It's about how you treat patients,
Yes.
You need to be humane, connect with them, give them time, not rushing, and that's what we do. And I can say everyone in my group shares the same mentality. So.
Oh, that's fabulous. As I mentioned before, I love to see this new group of doctors that are coming into phase, that really love the face-to-face interaction, and that are willing to give that amount of time to be able to really listen to their patients, to understand what some of their difficulties are, and also to tap into their emotional state as well. Because, a lot of times you might have a pain in your knee, but it might also be that, you've had some traumatic emotional disorder that has happened. Either one of your friends might have had a serious accident, or there might be some other complications. But, the emotions can play a part also in the pain and disruption of that knee.
Absolutely. Couldn't agree more with that. So you need to take the whole person, their psychology, their beliefs, their culture, religion, and then help them decide what plan works for them, what treatment plan.
Right. Well, and tell us a little bit. I mean, I'm pretty much familiar. There's been hip replacement and knee replacement out there for quite some time. From what I understand, there's some real state-of-the-art technology that's coming up around that. Can you explain a little?
Yeah, it's been amazing. I started practicing orthopedic surgery in 2000. At that point, a patient will stay in the hospital 4, 5, 7 days after having a hip or a knee replaced. And then we came to 3 days, 2 days, but now we're doing joint replacements as an outpatient procedure.
Really?
Because we have now surgical techniques with minimal cutting, protecting the muscles, protecting the tendons, not opening the skin as we used to.
Wow.
So, and we have technology implants that help us do that job. We have robots that help us be more precise. So many patients with hip or knee arthritis, they get their surgery and they can go home the same day.
Oh my God, it's unbelievable.
Which is a game changer, and it's been really mind-blowing, because I did not picture that coming when I started practicing orthopedic surgery 16 years ago. So it's been just truly amazing, and that's what makes the orthopedic field so exciting.
Oh my goodness, you're not kidding. Yeah, I remember, because how long has the hip replacement, knee replacement, joint replacement, how long has that been available? For the last 20, 25 years?
No, it's been actually 50 years now.
50 years.
Since they started in London.
Wow.
So we came a long way.
Well, you're not kidding. and now you've gone from 7 days.
Better.
Yeah, 7 days in the hospital. I mean, that's extensive cost right there. Down to outpatient surgery. That's amazing.
Right. We're saving money to the system, to the patients, and improving outcomes. So it's been wonderful.
That is incredible. So tell us a little bit about differences in pain so that our audience might be able to identify whether or not it's just regular normal pain or if it's coming from a hip or a knee. Give us a little bit more insight on that.
Yes. So pain is different for everyone. But what I recommend to my patients is if you have joint pain, hip or knee, for more than 2 weeks, and you try resting, elevation, ice, and some Advil, Aleve, Tylenol, and that pain is not getting better, you need to get that pain check. Because sometimes can be just a sprain, a strain, torn muscle, tendon, but sometimes can be something serious, or you may be just starting to get some arthritis. And it's very important to have at least an orthopedic doctor see you, get an x-ray, and do a full assessment to make sure that by continuing doing your routine activities, you're not doing more damage to your joints.
Yes. Very important, because I know that, I was a fitness trainer, and then I also work out as well. And it's, I always have to be aware, or at least I was when I was training, how my clients, how they were moving and how they were adjusting to the various weights that I was using and the various movements in order to build the muscle. And there were times where all of a sudden they said, "Oh no, I really have a pain there." And I'm like, "Oh, as soon as you have a pain, we're not doing it anymore, because we don't want to, damage anything, and we don't want to continue that pain. It's not worth it." And then as time went on, if it went away, then we could, resume working that particular muscle mass. But if not, then I would tell them, you need to see your doctor. That's all there is to it.
I agree. We're becoming more and more active. As we get older, we don't want to stop. We want to still participate in sports, go and train. But it's very important that if you have that soreness, that joint pain, talk to your doctor, because you can still continue doing your training routine or your sport of preference, but sometimes you're going to need to modify some of the training, some of the weights, some of the particular exercises that you're doing in order to avoid further injury.
Very good advice. Well, of course, you're a doctor.
Thank you.
Very good. So what are some of the treatment options if you say you have hip pain? What are some of the treatment options available?
So the hip is very interesting because there's a lot of tendons, a lot of muscles, a lot of nerves, soft tissues, and then the joint. So after doing a complete evaluation of the patient and maybe recommending some x-rays, you're going to be able, the physician is going to be able to rule out rule in very important diagnostics, and based on that, you may recommend physical therapy. Sometimes and oftentimes we need to recommend to lose weight, because weight, it's a lot of stress on the joints.
Yes.
The joints are designed for certain body weight, but because we walk between 1 and 2 million cycles every year, and every extra pound, it's 5 to 7 pounds of force when it goes through the joint. So imagine that million cycles and that increased stress on the joint.
Wow, that is really interesting.
So
wow.
Losing weight actually helps more than many of the other interventions that we can do.
Yes.
Then we recommend the therapy, sometimes braces, sometimes injections. Oftentimes we do a steroid injection to control the pain and inflammation. And sometimes we do something like hyaluronic acid to protect the knee. It's a natural substance that resembles the joint fluid and is good for some knees with some type of arthritis, some types of tears.
How long do they last, the injections? I mean, is that something that you can get once or twice within, say, 3 to 6 months, or is it something that, how does that work?
Typically, we don't want to inject steroids too often because they have some side effects. So the rule of thumb that I use in my practice is to wait at least 3 months before repeating the injection for the same joint. If we're doing the hyalgan or hyaluronic acid, we can do that every 6 months, but some patients go for 1-2 years without needing a repeat injection. Now, if everything else that we tried doesn't work and the patient continues to have pain, limp, and really can enjoy the activities they love, then we start considering surgery.
So I just want to take this time to say thank you to All County Healthcare for bringing these doctors, these professionals in their specialties in here so that we can learn about the various options that are available to us and also be able to choose what's best for us and to be able to identify. If you're dealing with some hip or knee pain, as the doctor had mentioned, really be aware. Is it lasting longer than 2 weeks? Have you been, icing it or taking Advil or Aleve to reduce the inflammation on it? Notice whether or not it's leaving or is it still staying. And if it's still there, then I would highly recommend giving the doctor a call. So how do they get a hold of you again?
So it's the Orthopedic Center of Palm Beach County. Our phone number is 561-967-6500.
Okay, excellent. So give the doctor a call. You can also call in if you have questions for the doctor tonight at 888-565-1470. We would love to answer any questions that you might have. And if you're streaming live on our Facebook, All County Healthcare, if you're on Facebook with us, please call 888-717-7170. Ask for Maddie, and she would love to answer any questions that you might have about All County Healthcare and also the physicians that we have, the doctors that we have on our show as well. So wonderful, absolutely wonderful to have you. Let's talk a little bit more about some of the causes of knee pain.
Yeah, that's very important because it's probably the joint that it's affected most commonly. As we play sports and a lot of impact goes through the knee joint. And we have different ligaments, we have the cartilage, we have the tendons, and the meniscus. The meniscus, we have 2 on each knee, and they're made of collagen, and they're like a soft gel. And they release some of the stress that goes through the joint, so they are extremely important for the longevity and health of the knee. So oftentimes during those sports injuries or sometimes just rotating the knee, you can create a torn meniscus. That's very frequent that we see that problem.
Yeah, I've heard of that before. And especially, as I said, being a fitness trainer, I've seen some people that have had to stop working out because of a torn meniscus.
Correct. It's extremely common. We'll give the patient some swelling, some clicks, pops that are painful. They can be really painful. It's one of the most common injuries. Ligaments playing sports, the anterior cruciate ligament is extremely common and oftentimes needs surgery to do a reconstruction of that ligament because it doesn't heal on its own. Sprains are extremely common. Those are just treated with rest, elevation, ice, and a brace to protect the knee, and then some physical therapy.
Okay.
But as we go through life, we all get some arthritis.
No, I don't want it.
It's the most common one is called osteoarthritis. It tends to get worse with time.
Okay.
So all the treatment options that we mentioned before, but it's probably the most common reason why we do surgery for the knee. When it gets to that point, we may need to do a partial knee replacement, which is done minimally invasive and the patient can go home the same day. But sometimes the arthritis is more severe and we have to do a total knee replacement. And again, it's not what it used to be in the past.
Yeah, I was going to say, they've really made some amazing changes in that technology. Am I not correct on that?
You're correct. So we're using these robots that help us balance the knee, place the implants in the right place 100% of the time. So they take a lot of the guesswork out of the picture to ensure that we get it right 100% of the time, and those patients can benefit and return to their activity levels. Because really growing up seeing our grandparents on a wheelchair, was kind of the norm at that point, but now there's a new norm. We stay active. We want to keep running, cycling, biking, and enjoying life, and that's really the key. So there's no real good reason why to be afraid of surgery. We all hear the bad outcomes.
Well,
and
yeah,
they stick
I mean, they
with
used
us.
to open you up. I mean, I have seen those scars on the knee, long, really long scars, and I'm going, oh my goodness.
No,
and a lot of time in the rehab as well, trying to get that knee working again, getting all the muscles to work together, and yeah, it was quite extensive.
Truth, but it's changed significantly. It's been really, really exciting.
That is exciting. I have one of my clients who is kicking and screaming because he doesn't want to get a knee replacement, but he's going through so much pain and agony right now. And I'm like, oh no, my doctor told me to wait as long as I possibly can until I cannot handle the pain anymore, and then to have it done, because then it's going to last for another 20 years. And I'm like, so you're going to take this time where you're younger, your body heals much faster than it will 20 years from now, and you're going to deal with this pain instead of just going in and getting it taken care of? For me, that doesn't sound like it makes a lot of sense, especially now when you're talking of this new technology and the new tools that are out there that gives you even a better recovery time. I mean, it sounds not fathomable that he wouldn't have it done right now. I of course I've been talking to him until I'm blue in the face, and I think I'm getting through to him, but I mean, that sounds incredible.
You're absolutely right. The most common comment that we get from patients is that they wish they did not wait that long, because they can see the difference right away, and they realize that in some cases they wasted precious years of life where they could have been active, enjoying more things that they wanted to do.
Yes. I mean, he used to love hiking, and now he can't hike. He can go up, but coming down, forget it.
Yeah, he gets his knee replaced and he can go hiking in 4 to 6 weeks.
That's incredible. I love to see that. That's so helpful. I've got your card. I'm passing it along.
Thank you.
As a matter of fact, yeah, because it just doesn't seem right that you give up this time in your life to pain, because pain takes you over. It inhibits your ability of really living a full and quality life. And, that's really what this whole show is about, living a longer and healthier life. That's what we want to teach people. So, just the fact that you're on and helping us understand that they don't need to live you don't need to wait until you can't stand it any longer, because then you might have wasted a good 7 or 8 years with this pain, because I know that's how long he's been dealing with it.
Correct. And sometimes we start taking medications that are not necessarily good for our system. There's a lot of side effects, there's addiction, there's overdose, they take your energy, and they really change how you perceive pain and life in general. So
well, Doctor,
I agree with you.
Yes, absolutely. I want to thank you much for taking time out of your busy schedule to come here and help inform us, help educate us about what is available out there for us, first of all, but also in order to be able to make the choices that are so important in our healthcare. We don't have to be sitting on the couch dealing with pain. There are alternatives. There are things that we can do that benefit us and allow us to have the quality of life. Because once we have the quality of life, we have the quantity of life. And that's what's so important. So I'd like to thank you for being a part of our show this evening. And I look forward to seeing you next Tuesday between the hours of 6 and 7, right here, same place, same station. I'm Lorena Anderson, your life and energy coach. And any questions whatsoever, please give us a call. We would love to hear from you. Call All County Healthcare, our proud sponsors, at 888-717-7170. Until then, we'll see you next week. Thanks for being part of our show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.